welcome to Access Rhode Island. My name is Kate Brewster, and I'm the Executive Director of the Economic Progress Institute and host of this week's program. As the state's economy continues its slow recovery, unemployment and underemployment remain high, leaving many Rhode Islanders unable to meet their basic needs. My guest this week is Andrew Schiff, Chief Executive Officer of the Rhode Island Community Food Bank, an organization that has been providing lots of assistance to both working and unemployed Rhode Islanders in the wake of the recession. Thank you so much, Andrew, for being here. We know you're very busy, especially around the holidays.
I'm very happy to be here.
Great. So let's just first start by talking about the food bank. What it is that you do, what services you provide, and how you work with some of the local organizations to serve residents.
Sure. So we're working with agencies across the state. There are 178 member agencies of the food bank.
Wow.
So these are food pantries, soup kitchens all across the state that receive food from us and then provide that food to people in need. Some are open every day. They're serving thousands of people a month. Some are smaller programs out of a church basement, completely volunteer-based, and those programs may be open once or twice a month. So we are able to make sure that whether a small program or a very, very large program, that they have enough food so that no one is ever turned away. That's our goal.
Well, you're certainly doing an amazing job. You just released your annual Status of Hunger report, which is quite a piece of interesting read. It provides tons of information. What is the status of hunger in Rhode Island? What are we seeing?
So the USDA does a survey of all the states, and we get results for Rhode Island. And what it shows is that over 15% of households, that's 67,000 households, can't afford adequate food. And that means that for some, they're skipping meals, they're cutting back on meals, but all because they just can't afford adequate food. There are other families that are literally running out of food, so that even children in the household aren't eating. And that is really scary because those numbers have gone up significantly since the beginning of the recession. Mm-hmm. More people unemployed, more people out of work. It means more people can't afford food.
And if I understand correctly, we're seeing working families. Maybe they're working part-time. One of the things that's happened is that people are working fewer hours. The wages have been stagnant. So what we hear from food banks, I think, is that the growing number of working folks who are showing up.
That's right. So you have people who were out of work. They couldn't wait for their job to come back, so they took a job, one that paid less than the one they had before. The entire family's income has gone down, and folks now just don't have enough money to pay the bills. And they turn to food pantries to be able to get through the month and have enough food to feed their family members. The type of families that need help now has changed a lot. So that you have folks who never needed assistance of any kind before. And we're very fortunate in the state that we have the 211 number run by the United Way, so that when people are in crisis, there's a number to call. They speak to a person who will tell them exactly where in their community they can go, what days. And that's been a really important resource for families that are in crisis that have run out of food to be able to get quickly to a place that can help them.
And it's probably worth pointing out, Rhode Island, unfortunately, has some of the highest food insecurity numbers in New England, according to this report.
That's right.
Which I suppose is not surprising, given we have the highest unemployment rate.
Right. And so one follows the other. I think that for us, the concern is that we had thought that by now things would have plateaued, that things would have begun to improve because there has been some economic recovery, but not for the communities that we serve. And that is the biggest worry right now. When are we really going to see enough economic recovery, enough jobs created so that there's an improvement in the problem of food insecurity and hunger?
Yes, and the numbers have continued to climb, as I understand it, in terms of the people served, as you pointed out, since the recession has officially ended.
So the number of people coming for help, both to charitable programs and to government programs, is at a record level. So we're now serving 66,000 people each month at food pantries across the state. And the number of folks who are enrolled in SNAP, formerly called the food stamp program, now 178,000 people. So those numbers haven't plateaued. Every month we've been seeing them grow.
And a lot of attention has been paid to SNAP, as you formerly food stamps. I don't think any of us can say SNAP without saying that after it. What has been, clearly the recession and unemployment has caused many, many more families to seek help. And when you think about it, there really isn't that much help for housing. There's not that much help available, so people first are paying their rent. They may be able to get right care health insurance, but food now has become another need. So we have the recession, but there is also outreach and some other factors that have gone into growth in the SNAP program. Can you talk a little bit about those?
Yeah, so the folks at URI who are in charge of SNAP outreach do a terrific job. They focus a lot on our member agencies and making sure that there are people to help folks figure out if they're eligible, to screen them, and then to explain to them how to apply. But what I think they've seen at our member agencies and at other organizations across the state is that people who are unemployed and on unemployment benefits then exhausted those benefits have no income. And so that's the crisis. And so now a lot of people, the only benefit that they have is SNAP. And they need that to be able to feed their family, and they turn to friends and family for everything else. Our concern is that people wait too long, is that if you're unemployed, if your unemployment benefits are running out, you should really get enrolled in SNAP. SNAP is, an income-eligible program, so the only folks who are able to get it are those who go through the application process. What we've seen is the number of folks has almost doubled, more than doubled, since the beginning of the recession in SNAP, which means that there are that many more people who are eligible. Also, more people have learned about the program through the SNAP outreach. And I think also that a bit of the stigma of the program has disappeared because people understand you got to feed your family.
Right. What's been difficult with all of this is that the caseloads, it's just worth mentioning, at the Department of Human Services, while needs have gone up tremendously, staff, the public sector and staff have not grown. And so we're seeing caseloads of what? How many?
Over 2,000 per caseworker.
Over 2,000.
Right. So, you just imagine what that's like. It's completely unmanageable. And folks will say that it's a customer service issue, but I think it's much more than that. If people who are eligible or people who are in the program can't reach their caseworker, that means they can't make changes. Say that your hours at work were cut. You should be able to get a higher level of benefit. You can't reach your caseworker. It means that you're not getting that higher level of benefit. So it really hurts families to not be able to easily communicate with the caseworkers. It is not the caseworker's fault.
Right.
They just have too many people depending on them.
Right. Right. And we saw with other programs like unemployment where staff were able to be hired, and I know that the department is trying to get a handle on this, but it's really, it's a crisis that needs to be addressed for sure. And it's worth mentioning that there is a piece of legislation in Congress that is pending known as the Farm Bill that, among other things, would actually result in cuts to SNAP benefits for many people if passed. Can you tell us about the impact of that legislation and the status of it today?
Sure. So, Congress began to focus on SNAP as a problem because the federal government is spending more than ever on the program. But that's because more people than ever are enrolled.
Right.
And that is actually the way the program is designed. If we go through a recession and people's income goes down, they qualify for the program, so more people get the benefit and benefits go up. As economic recovery takes hold, the caseload of people enrolled in the program will go down, and less federal spending will have to go toward SNAP. But Congress has been completely impatient with the number of people getting help through the program. And so they, through the Farm Bill, which is only reauthorized every 5 years, so this was kind of their chance, they decided to actually cut benefit levels and cut people from the program. We looked at how it would affect Rhode Island. And if the House version of the Farm Bill goes through, and it easily could go through as part of this fiscal cliff negotiation, 12,000 people will immediately have to be terminated from the program, and another 30,000 households will have their benefits decreased. Now, we've just been talking about the fact that food pantries across the state have seen double the number of people in the last 4 years. They're at capacity. Any idea that the charitable food programs are supposed to pick up the slack when government programs are cut is crazy. We've talked to the staff of our congressional delegation, and in particular, Senator Rhode was very, very strong that he does not want to see these cuts to SNAP in the Farm Bill.
And as you've mentioned, it's all federal money. And it's money that flows directly into people's pocketbooks and out into the grocery stores and other merchants. So
that's right.
How much money are we talking about our economy potentially losing?
So last year, SNAP benefits were $275 million to our food economy. This is spent in supermarkets, just people buying food in supermarkets and grocery stores. The cuts that are planned in the Farm Bill would equal $50 million a year out of our economy at a time when we absolutely can't have less spending and, fewer jobs, because that's, ultimately that's the effect. If people aren't able to shop, they aren't able to spend money in stores, stores will lay off. And that's just a terrible cycle for us to get in.
Right, and I just wanted to mention there are some other federal nutrition programs that are really important to folks in Rhode Island, especially children, that also bring federal dollars to our state. Can you just touch on those?
Yeah, similar. WIC is a program for parents with young children. This is a very similar program to SNAP, that the benefits are used to purchase healthy food in stores that carry WIC food. WIC is also a nutrition education and health program, so the participants are getting a lot more than just the food benefit, but the food is matched to the needs of very, very young children. So it's been shown over and over again to improve the health of kids, the health of families, and right now we don't have everyone who could be enrolled in Rhode Island enrolled in that program. We have about 25,000 participants. We believe that there are 40,000 folks who are eligible. So we want to do more to reach out and make sure that folks are enrolled in that program. And then for school-age children, their school meals, school lunch and school breakfast are critical programs. And a good thing is we have seen more children taking advantage of school breakfast, which we really see as a very, very important program for kids who often don't have enough food at home.
And even kids who do. I find my 4-year-old doesn't want to eat when he first wakes up in the morning. And sometimes, it takes a while for them to become hungry. And what a great opportunity once they get to school to be able to do that.
Absolutely. So, in families rushing in the morning, kids are on their own time and schedule and may not eat. But teachers know when kids haven't had something to eat by, mid-morning, they can't learn.
They crash.
So it's really, really critical that we make sure that kids have the nutrition that they need to learn.
Right. So many important issues, and let's hope that the Farm Bill issues, the cuts don't go through, and we'll be watching that carefully as negotiations continue. Unemployment benefits, too, just worth mentioning, are scheduled to be exhausted, and thousands of Rhode Islanders would lose those if that's not dealt with as well. Right.
So we have seen a steady cutting back in the weeks that somebody can be on unemployment benefits. And so that has really hurt the long-term unemployed. So unemployment benefits are not paying you what you were getting paid your job
Right.
before you got laid off.
Right.
So folks are getting those benefits, but also running through their savings.
Right.
So you cut them off unemployment benefits, they have nothing.
Yep.
And I really don't think that folks understand how devastating this could be, not just for that individual adult, but for the whole household.
Right. Absolutely. Hi. Go back to the business of the food bank, and the Status of Hunger report touched on a lot of issues. And one of the more interesting items is that the production of food and grocery management, if you will, has gotten much more efficient and has resulted in less surplus and less donated food for the food banks across the country. So what has this meant for your organization?
So this is a national trend. Food banks were set up in the 1970s and 80s based on the idea that there was a tremendous amount of surplus food that was getting thrown away. Mm-hmm. And to a certain extent, that was true. Supermarkets really liked the idea of being able to donate the food rather than throw it away. And so it was a no-brainer for everyone.
Right.
And the food bank's job was just to get the food in and out as quickly as possible. The stores would take almost full responsibility for the donations. They would collect them at their stores, they deliver them on their trucks to food banks, including the Rhode Island Community Food Bank. And what you needed to do is have volunteers, for free, sort through the food, make sure that the dates were right, and now that food would be boxed and go out to the agencies that directly provide food to people in need. So everything was basically free, except for the warehousing of the food while it was at the food bank. Mm-hmm. And if the food bank in ours does this, not every food bank actually delivers on trucks, but that was also an expense. But expense was minimal. Mm-hmm. Then what began to change is, first of all, at supermarkets, computerized inventory. So stores know exactly how much to have on the shelves. When I began in this business, I was providing grants to food pantries, and they would ask all the time for a refrigerator because there was a tremendous amount of yogurt and dairy products that were being donated, and they wanted their healthy food. Mm-hmm. They wanted to be able to store it and give it to people in need. Now there's no yogurt donated because everyone at the supermarket has figured out exactly how many they need on the shelves, how many they sell every day. It's a system that works for them because their job is to sell food, right, not to donate food. And they've gotten better and better at that, and there's tremendous competition in that industry. The other thing that's happened is we would get items where there was some error on the cereal box, right, or in the labeling. And that never happens anymore because of quality control. So what's happened is that the food bank has to now purchase food. Mm-hmm. And it means that we have to have a whole different level of expertise than we needed to have in the past, because procuring food requires knowledge about where to get food, how to get it at the lowest price, and also it means coordinating with other food banks so that when we bring in food, we're bringing in truckloads of food, because that's the best way to bring down the cost and also make sure that we're bringing down transportation costs by bringing food and sharing it with other food banks in New England. So this is suddenly a whole new area for the food bank, and unfortunately, it's grown to now 40% wow. of the food that we bring in is purchased.
Wow.
At very low cost from wholesale. And one thing about it is that we can, in addition to making sure that it's low cost, also make sure that it's healthy food. Mm-hmm. Before, obviously, when we were getting donations as the 100% of the food we got, we didn't have any control over what food we got.
Right.
But now we know that if we're going to purchase and use donor dollars to purchase food, we're only going to get healthy food.
Which is one positive upside.
It is one positive.
Which is terrific. But certainly, you don't think about these other things. Modern technology, and the impact on the food bank, it's incredible.
And it's, one thing that's important to say is it's not because the supermarket industry doesn't care or
right.
they're not philanthropic. Actually, they're very, very generous. Their world changed, and the model of food banking has to change.
Right. Very interesting. Well, the food bank, that's a great segue into this, what I wanted to touch on. You don't just provide food, and it's one of the great things about your organization. You do so much. So in addition to all the things that you've described, you operate some very unique programs. I wanted to mention earlier, you talked about WIC, and I remember that you were starting a program where you were having volunteers actually go to supermarkets and shop with WIC recipients.
Right.
Is that still happening?
Well, so one of the challenges with WIC is that you are only allowed to purchase certain foods in actually certain size boxes and cans, and so it can be intimidating. And what we tried to do was match WIC recipients with volunteers who go through the supermarket with them and show them. We actually want to expand that so that at food pantries we do actually on-site education for folks both who are receiving WIC and people who are eligible but not enrolled, and just educate them about the food that they can get and the specific foods that will change depending on the age of their child, infant to 1-year-old to 2-year-old. We're excited to do that because, again, that's all healthy food, and that has become sort of more and more of an important goal for us, that we not just feed people, but we feed them well.
Cooking classes?
Yes. The cooking classes are extraordinary. So people at food pantries will say, I would cook healthy, but it's too expensive. And we say, wait, we can show you that you can cook healthy meals on a tight family budget with recipes that we provide. We also, literally show through cooking demonstrations how to make the meals that we're suggesting. People taste them, they realize they're delicious, they take them home, they try them, they're a hit with their family, and so they continue. We actually did a study and found that 6 months follow-up, the classes just last for 6-7 weeks, and then we followed up 6 months later. People were still making the recipes 2 or 3 times a week.
Incredible.
So we thought that was a great success, and it's made us anxious to just try to roll it out to more food pantries and more people.
That's terrific. And I'll also mention the community kitchen,
yes,
which is another gem offered at the food bank. Tell us about that.
So a lot of people don't know that we have a job training program at the food bank, but it's actually been there for now over 13 years.
Wow, I didn't know.
And the same chef instructor, Heather Langlois, has been in charge of the program now. Tremendous experience, as you can imagine, running the program. We get applicants who are unemployed, people who lost their jobs in the recession, particularly now, and whatever career they were in, whatever industry they were in, they see no chance of that coming back. So they've made this decision in their lives to begin on a new path. It's 14 weeks every single day, Monday through Friday. So it's a commitment because there's no pay. So for those 14 weeks, a family member has to provide child care, somebody else has to cover the rent so they can get through this program. And actually at the end of the program, we have a formal graduation to a certain extent to mark the success and the accomplishment, but also part of it is to thank the families and friends who provided the support for people to get through. They learn culinary skills, they learn life skills, they learn an approach to looking for work. The 6th week of the program, every student is placed at an on-job training site each Monday of the week. And so we have these wonderful restaurants, catering services that will take our students who are not experienced chefs and put them to work in the kitchen so they really see what it's going to be like. A lot of those on-the-job training sites end up hiring our students, which has been fantastic. And our students have been, 95% have been getting work within 3 months of leaving the program.
Wow. Wow, that's great.
It is really good, in this economy. One of the reasons that we're successful is because we have so many alumni now all over the place who are working nearby in restaurants, catering services. And what we're really proud of is, even though often after graduating our program, people have to get very difficult beginning level jobs in the food industry. So they're cutting carrots in a nursing home cafeteria for hours on their feet, but they do work their way up, and they get better paying jobs, and they get more responsibility. And that's one of the things that's covered in the 14 weeks, is that with the food industry, it's a good part of that industry, is there is a ladder to climb.
Well, and I'm so glad you mentioned the nursing home piece, because there's so many opportunities when you think about cooking.
Right.
And Rhode Island, we're known for our restaurants, our hospitality. We've got a growing population of baby boomers who will be, seeking care, and it's just the opportunities are tremendous.
Right.
Which is terrific.
It is. And so we have, seen our students really thrive through the program. It is, very, very rewarding for those of us who work at the food bank to know that part of what we do is helping people become self-sufficient.
It's amazing. One other quick program I wanted to mention that I think is unique that you administer or operate is the Women Ending Hunger Network, which is terrific, and I've been to those meetings and presented to the group. Tell us a little bit about that.
Yeah, so we have a group, all volunteers, run by volunteers, now run by Mary Flynn, who's a research dietitian at Miriam Hospital, and Susan Gustatus, who is food pantry director.
In my neighborhood, in Wakefield.
Yep, the head of the Johnny Cake Center in Peacedale. They're the chairs of Women Ending Hunger, and the group meets 3 or 4 times a year, very, very focused on advocacy. People so often ask what they can do for the food bank, and there are the obvious things you can... Which
is a great segue into our last minute. What can you do for the food bank if you've been watching?
You can give food, you can give money, rifoodbank.org, and you can advocate. On our website, rifoodbank.org, we have a page, Advocate for Change, that says what you can do to help change that farm bill, to improve things in the state, and make sure that the resources are there for people in need.
We're in the middle of a holiday drive that will still be going on when this program airs.
Yes.
Tell us about that.
You can come down to the food bank. It's a great opportunity to show your children the scope, because the food bank's a big place, of the problem, but also show how important it is to donate, to give to people in need. You come to the food bank, we'll show you around, and we will definitely show a lot of appreciation for any donation.
Such an important organization. Andrew, you and the staff over at the food bank, Lisa Roth-Blackman, who is our board chair, is your chief philanthropy officer. Just a great bunch of folks over there who do tremendous work for so many Rhode Islanders. I want to thank you for all the work that you do.
Thanks.
Wish you happy holidays, a happy new year, and encourage viewers to call the food bank or visit their website at, one more time?
rifoodbank.org.
rifoodbank.org, and be sure to give not only this holiday season, but throughout the year there's need. So thank you again for being on the show.
Thank you.
It's terrific.